All right. Dr. Nisha Chellam, thanks so much for hopping on here on Medicine Redefined with us.
Oh, thank you for the invite.
Absolutely. So we're going to be talking about functional medicine and maybe a different angle of it, right? Because you wrote a very thoughtful LinkedIn post about why you're going to stop going to functional medicine conferences. But I think
Yeah.
every provider who decides to go into the lifestyle medicine realm, the functional medicine realm, has a different story. They might have similar themes as to why we join or, think that side of medicine is attractive. But I would love to hear your story first. You start out with internal medicine. How did you first learn about functional medicine and what made you really take that leap into practicing it?
Yeah. Thank you. So I will say I have practiced now medicine for 31 years. This would be my 31st year. So I was a hardcore internist from, I will say, 1990 till about 2000. Internal medicine was something that really attracted me because when I finished medical school in India, I hated medicine. I had only one goal. I wanted to marry and settle down. That's it. And I wanted to marry a doctor so I could make use of my medical degree, maybe run his clinic and just settle down. This was just the only ambition I had.
Passengers keep practicing, I guess.
Yeah. So I don't know, somewhere around that time, my first job was in an industrial setting. So it was a cement factory. I don't know if you guys know, there's a blue chip company in India called Larsen and Toubro. They made tractors. So my father worked there. So I got a job there, nepotism. So I landed my very first job as a primary care in this village setting. And I had no freaking clue what I was doing. I finished MBBS, you do an internship, and then you start seeing patients. I used to be scared seeing every patient because I had no clue. Because, when somebody comes in with fever, you're thinking about malaria, and what they have is urinary tract infection. So I felt very ill-equipped. I knew I needed to do a post-graduation, so that's how I came to the United States. And the very first day I was on the floor, and you know what an internal medicine floor is like. It's like either you're going to get one code, you're admitting patients, and those were the days when we didn't have a night float. You start call, you do 36 hours of call. And I remember falling in love with medicine. And what I realized is one of the things in India is when you see a patient and you make a diagnosis, and I don't know if you guys ever seen like an Indian professor, traditional Indian professor, he's like the king. And we're all standing around him like peasants, waiting for the pearls of wisdom that fall out of his mouth. So, they would do a diagnosis. At that time, we didn't have CAT scan, ultrasound. Patients will just walk in and he'll say, Horner's syndrome. And we're like, how the hell did he know? The guy is 10 feet away. And how did he know it was Horner's? And in India, it's hot. People are sweating and they wear this holy ash, the vibhuti on their forehead. Mm-hmm. And on one side, it was dry and the other side, it was gone because the sweat had taken it away. And in Horner's syndrome, you don't sweat on one side. And then when he came closer, you see the meiosis. And we were all like, that's the image. We wanted to be as good diagnosticians with clinical medicine. So a lot of the training in medicine is about the disease. We'll surround the patient. We'll talk about all his symptoms, signs and symptoms, give a differential diagnosis. It was so much fun learning medicine, but I never connected with it because you give a treatment for a patient, they couldn't afford it. But when I came to the US, you order a CAT scan, you could do a CAT scan. You give a prescription, they get a prescription because there was this notion of insurance or Medicaid or whatever that might be. So I really fell in love with medicine. And I wanted to be a hospitalist for the rest of my life. And 2 years into my hospitalist job, I found it was the same patients coming through the revolving door. So the first time they come in with congestive heart failure, you treat them, you consult nephrology, you consult neurology, you consult cardiology. And you have all these consultants, you coordinate the care, you get them walking out of the hospital, and the next time they're coming in wheelchair, and in about 6 months, they go out in a gurney. And it's the same thing. You're treating the same issue and the patient continues to decline. Doesn't matter what might be the cause. It may be they're non-compliant with the medicines, whatever that might be. Medicine became a job where you go every day to fail. And I don't know how many professions you can say that I go to work, I solve this problem, And the problem is never solved. And I continue to solve the problem tomorrow and just gets worse, but the numbers get better. And that's how medicine, it was one of those things where I hated Mondays. I didn't want to go see my patients. And I had joined the VA by then. And the veterans are they're a very unique population. I loved taking care of them, right? They'll come and say, Doc, I know you want me to change my diet. It's not going to happen. So just give me the medication. And half the time they won't take the medicine either. My bonus was tied to their LDL. So if they didn't have an LDL of less than 100, I didn't get the bonus at the end of the year. So we were spending all this time trying to get them to be compliant with their medication. So you start off with a blood pressure medicine. You give them a diuretic, then they get gout, and you say, oh, this is coming from the blood pressure medicine, so I'm going to give you an NSAID for your pain. Now you have a kidney problem, so you're going to see the nephrologist, and then he says you need to give another blood pressure medicine to control the kidney failure, and we're going to start him on statin because his cholesterol is going up. And before you know, he's on these 25 medicines. His list of diseases have increased. All his numbers are under good control. Blood pressure is under control. LDL is under control. A1C is under control, but he's feeling lousy. And this is where I think you kind of get frustrated after some time. What do you need to do in order to get people better? Obviously, medications were not the answer. So around this time, I had a patient, a 50-year-old. I still remember his face. He had a ponytail. He came from Hawaii. He moved from Hawaii, and he had a colostomy bag. So he had his colostomy bag put way back in his 20s because he had ulcerative colitis. And his skin was rough, his hair was falling, and he was concerned about his hair falling. His vitamin D, I remember, was 6. And I remember giving him vitamin D. And then I also asked him to get a bone density. This was like in 2003, maybe 2003, 2004. And he had severe osteoporosis. And at that time, Fosamax was the only medication that was available for osteoporosis. He refused to take it because of the osteonecrosis, usually with post-radiation, but he didn't want to take a medicine. I asked him to see the endocrinologist. He said, Doc, you give me a couple of months, I'll come back. And he disappeared from my clinic for 2 years. He came back and his bone density had improved. So I asked him, you didn't take Fosamax. How did it improve? And he gave me this list of supplements and he told me all the exercises he was doing. And he showed me the kind of yoga poses that he did that actually improved his bone strength, and he felt phenomenal. And to me, that was the first time I realized there's a different aspect of medicine that I've never learned. What are these supplements? And I remember going on a hunt trying to find out what integrative medicine was at that time. And so I got exposed to integrative medicine. I will say I loved it the very first time because for the first time they were asking questions about why a person is ill rather than what it is. They emphasized so much on why someone has it. And I remember going to my very first functional medical conference too. And for the functional medical conference, I will say the very first day I thought it was all cool because he said, we got to take out gluten, we got to take out dairy. And I'm like, oh my God, what are these guys talking about? It's a fad. But I remember Mark Hyman was the keynote speaker, and I think he gives the same talk, by the way, with every functional medical conference because he's a keynote speaker. It's the same patient who has asthma, dermatitis, and he shows a picture of her evolving and getting better and getting off medications. I remember that particular evening, I literally cried because for the first time, I realized how medicine should be practiced. Because a lot of times we focus so much on the disease, we don't realize why the disease develops in an individual at that given time. So I remember that was the first time I decided I needed to get into functional medicine and make it a way of my practice. I was in private practice by then. And I will say I was my first patient. And in about 6 months of doing all the things I was supposed to do, doing the tests, changing my diet, taking the supplements, my migraines, I had started developing them at the age of 11. My eczema, which I started at the age of 8, I was 42 when I got exposed to functional medicine. Literally in 6 months, I had none of them. Everything, I didn't have to use Flonase. I never had a headache, and it's been 17 years now, and I haven't touched any of those. It just altered my life. And after that, how do you practice conventional medicine? I don't know.
Thank you for sharing that. That really is awesome. A couple of follow-ups. What year was it that you came in, you were a hospitalist in the States?
1993 to 2000.
Yeah. So 90s. Again, probably at that time, 25 years later, like the system in terms of reimbursements and all that stuff, I think,
oh my God.
Was that still considered, is that when that stuff was being rolled out for you? Were you seeing the first wave of that type of stuff?
Nope. Actually, that was I would call the golden era of practicing medicine in the US. Yes. It's 93 to, I will say, almost 98. I had no trouble. And then I was 10 years at the VA where you never, right. It's a whole different system.
Yeah. And so you mentioned you were a hospitalist, but you also pointed out, certain metrics were tightly correlated with your bonus, at least in the positive sense. So you were also seeing patients outpatient?
Yes, we had so the metrics was when I left my job as a hospitalist, went to the VA. So the VA has metrics. Yeah. So I was an outpatient there. Yeah. Okay. I didn't do hospitalist as the veterans at the veterans.
So what I find interesting is here, so we had 3 brown people here on this podcast talking, and most of us, just by the nature of our background, our parents talking about like, okay, you hurt yourself. The first thing that's going on there is, we all call it haldi, right? It's turmeric, right? You're putting that, we're putting it. Yeah. And so you said that this world of supplements was novel to you. Mm-hmm. So surely you were familiar with some of those things, growing up in your family. Was that not part of your culture in terms of some of those supplementation, some of the quote unquote alternative things? Or was that new to you as well?
No, I've always been raised with Ayurveda. Right. I've had hepatitis C. I've had measles. I've had mumps. I never went to see a doctor. My grandmother treated me. And she would just, and we went to the Arya Vaidya Shale, where you get the Ayurvedic treatment. I didn't know what I was getting. I just had it. Gotcha. And I would come back home. So to me, we didn't consider, so illness was something, nobody was chronically ill. These are all acute illnesses, right? And they even naturally will get better. It was just more of symptomatic treatment when you went to go to Ayurveda or get the Ayurvedic herbs. But I didn't even consider that as a treatment. But interestingly, when you say that, I will say this. When I was in medical school, people will come to us with a broken femur almost 6 weeks after they broke it, because they would have gone to the Ayurvedic hospital and had some herbs wrapped around that, and we would be yelling at them and telling, why would you do something like that? A lot of our patients, we would chid them because we would go to Ayurvedic practitioner. We would tell them that was not real medicine. They needed to come and see us. Do you understand like how much the brainwashing of what is English medicine? And many of them would come and say they would gather their daily wages to get this English medicine so they can feel better. So there was that. It's a form of, I don't know, I would say medical training is almost dehumanizing us. We are so, what is the 235 causes of cirrhosis of liver? That's more important than how do you help a person with cirrhosis of liver get better? And that's what our whole concept was. So yes, it never occurred to me at that time. These supplements could be connected to Ayurveda.
Nisha, let me push back on that one a little bit. Don't you kind of need to understand one to be able to do the other? For instance, you said if you can't understand what the possible reasons for a potential diagnosis are, because you emphasize the importance of why, if you don't know all the what in terms of the background information, the foundations, aren't you going to be less likely to arrive at the why sooner?
So since I've practiced for 30 years, I don't know how many editions of Harrison's there have been. If you look at the 1984 edition of Harrison's, I'm really aging myself here, but any chapter would have etiology, would be 4 or 5 chapters, and the RX was 1 page. Now the RX is 10 pages, the etiology is 1 paragraph. So the way it's more of signs and symptoms and arriving at the right diagnosis in clinical medicine was the focus. It was never about treatment because our treatments were very limited. It's more of symptomatic. You have dropsy or edema, you give them digoxin. At that time, it was digoxin and some kind of a diuretic. It was just simple, but we're not talking to the patient about why did you get this congestive heart failure. At that time, it used to be rheumatic fever and mitral stenosis, and you had to change the valve. So you have those very specific conditions. It's later on in 2000, we started seeing chronic diseases for which it is pretty much the stressful lifestyle, the foundational, diet, a lack of exercise, lack of sleep, chronic stress that is driving. So I've seen a shift in how disease has evolved. And cardiovascular disease is something that we used to see before as like, you're almost dead once you have a heart attack, whereas now it's the only condition that's completely reversible. Yeah. So I will say, yes, you need to understand the reason, but we are not taught to focus on the reason. I've never asked my patients what they eat for breakfast, lunch, and dinner till I became a functional medical doctor. And I can tell you a story, really the most interesting part. This was a patient of mine I saw in my conventional medical practice. So I'd gone to this AFMC, the 5-day functional medical training, came back, and I felt like I just need to practice this kind of medicine. So they give you something called a timeline, where they'll say you've got to identify the triggers and you have to identify the mediators. So what started the disease and what is promoting the disease. Now, I remember this was a young girl. She was only in her late 20s, but had high blood pressure. And she was of Eastern Asian origin. I don't know if it was Vietnam or Korea. But she would come and see me regularly. She and her husband would come, and I would take their blood pressure, give her the medicine. She was on 5 blood pressure medicines. I'm not even kidding. And I could not figure out why she had a high blood pressure. So when I did the functional medicine, she was my first patient that afternoon when I came back from the conference, and I told her, I've gone to this functional medical conference. Can I try taking a history a little differently? And I took her history, and for the first time in my life, I realized she was adopted. When I went back to my original medical history, it says adopted family history not relevant. But now, when I was taking the functional medical history, she actually told me how she was adopted, how she was hiding behind a table, how her adoptive mother came and picked her up. And when she came here, now recently her adoptive mother had died, and that's when her blood pressure started going up. And every visit, she would come with her husband, and I would go over the history. But this is the first time I started identifying reasons why she was stressful. And I'm not kidding you. 3 months later, I asked her to come back. I made her do some dietary and lifestyle changes. I gave her blood work. She came for the first time alone. Her husband didn't accompany her. And I said, oh, what happened to him? And she said, I divorced him. We are separated. And I'm like, what happened? So she said, when you took the history of the other time, I realized why I was stressed. And I knew I needed to quit this relationship. It was too toxic for me. It was mind-blowing because that was the first time I spoke to her about her life. And this is where functional medicine gets into so much of depth of an individual's life. It literally shifts their health. And I was able to send her home with just 2 medicines because her blood pressure was dropping. Do you understand? So when you talk about etiology and treatment, that's where the difference is.
This is very curious. So I want to go back to what you were talking about maybe in the first 5 minutes about India versus US, right? Because the way you described what you were learning in India, where you have somebody kind of pointing out the obvious that isn't obvious, right? When you talk about Horner syndrome, that to me sounds like the Sherlock medicine Sherlock Holmes of medicine, right? And so many pre-medical students write about that in their personal statement. That's what they think medicine is going to be. But yet, but in the US, it's a lot more social work, right? I mean, a lot of it's like you said, it's how do you set up the environment at home so that they don't come back? But without a doubt, they're coming back with an issue that was greater than what we even try to treat them with. So I'm curious about what was it about the training in India that you didn't like? Because it almost seemed like functional medicine is more relevant to what you were learning in India with more that Sherlock Holmes mindset and really digging and trying to find out the pieces.
Yeah. So I will say when I look back, the way medicine was practiced, it was almost like there was this godlike figure, your professor, and how he examined the patient, how he diagnosed the patient, that was more important than actually making a patient feel better. It was almost the diagnosis it was the pinnacle of your connection with the patient. I've made a diagnosis and that's it. Now, whether the patient got better or not, they didn't use any Ayurvedic or, healing thing. They would just say, white medicine, the medicine with a line, medicine that's blue, take this in the morning, take this in the afternoon, take this in the evening. That was it. There was no conversation with the patient about what they needed to do, why they had it. They just took that and went home and started taking those medicines when they ran out. They didn't know they had to come for a refill. So it's a very detached way of practice, so much of showmanship rather than medicine. And in US, I agree with you. It's a lot of the social work and more of documentation. Don't get sued. Make sure you put all your accounts out. One of those mentalities. And so being a doctor is no longer a joy. You have to find a different way to have that relationship with the patient. And I think for me, functional medicine created that kind of a space.
Gotcha. Awesome. Yeah, it's funny. And it still holds true today in India. I'll talk to my relatives who, might have back pain and call me and say, hey, what can I do? And I said, well, what have you got done? And they said, I don't know. A doctor just wrote a script and said, take this 3 times a day. Exactly what you said. So I guess it's still happening. It's a very authoritative, very paternal, magician-like medicine, right? So very cool.
Yes.
Well,
yes.
Let's transition to the post you wrote on LinkedIn. So you wrote a very eye-opening post, which, prompted my attention and asked you to come on to this podcast. And so tell us a little bit about why you will no longer be going to functional medicine conferences. What prompted that for you?
Yeah. So my first functional medical conference was in 2012. And since then, I've gone to every functional medical conference and I've seen a transition. When I went for the first functional medical conference, there was so much of biochemistry, physiology, understanding, the foundational. This is the lifestyle that you need to, what are the modifiable risk factors? So what are the 5 pillars of modifiable risk factors, which is your nutrition, movement, stress, your sleep, and who do you hang out with? Are you hanging out with people who respect health, or are they drinking alcohol every evening and that's what your life is about? So somewhere in the 2000 teens, later, like I would say 17, 18, I started noticing there was a lot of emphasis on the treatment. They'll say, you got to always address the lifestyle. And then suddenly there was all these protocols. And these protocols got so complex, right? You want to give this at this time, and then you want to follow it up with this, and we want to give so many pills of this, and you want to give it at night. And by the end, you can see the whole chat because we had a lot of online and all. Everybody was asking, so what did he say? What should you give? How many milligrams? And we were doing just the same thing as we did in medicine. It's like all about the treatment. And no one was asking, why is the patient having this problem when you do a case study? And a lot of it started moving more towards what are the different supplements that will support bringing down your blood pressure, bringing down your cholesterol, your blood sugar, but not enough about the lifestyle, the stress factors that drove that individual to have a specific complex medical problem that is now chronic. So I would come back after every functional medical conference and, in our group, we will discuss, because many of us would have gone for the conference, and we'll discuss, hey, let's share notes. Let's see. We can spend 3 weeks on how much calcium to give for osteoporosis, right? Just literally, what brand of calcium are you going to give for osteoporosis? But I'm like, is this patient drinking wine every evening? Are they doing any strength training? What is their stress factor? How do they eat? None of that seems to be relevant because we say, oh, the health coach will take care of that. So once again, we have become reductionist in our approach. And I'm noticing this more and more with functional medicine. And then the other thing, which I was talking about before we started recording, is that functional medicine is not like a certificate you get. It's not a degree that you get in medical school. Somebody told me this, right? It's not a degree. It's a certificate. So anybody's a functional medical practitioner. So what makes me unique? What makes me stand out amongst the sea of functional medical practitioners? And that's going to be how I approach it and the depth of my knowledge, my experience, my knowledge of the 5 years of medical school that I did and working on the physiology, pathology, and biochemistry, rather than just saying, okay, here are the 10 supplements, take these at this time of the day. Yeah.
Yeah. You said a health
Does
coach.
that answer the question?
Yeah, no, it does. It does. There's a lot to unpack here too. I think you said a health coach will take care of it. Is it pretty regular that providers work with health coaches that will deal more with that behavioral change? And therefore the provider, to make themselves unique, will probably do more of the protocols and supplementation?
Yeah. So I will say when I started functional medicine, I've always worked with a health coach. I've never done functional medicine without a health coach because I'm not trained. And keep in mind, I come from India, right? I'm going to say, I'm going to call a spade. I don't know how to tell you, does this feel comfortable for you? That's not me, right? I'm just going to say, you're going to have to stop smoking and you're going to start eating healthier. And that doesn't fly in a place like this. You got to build that relationship. So I always had a health coach. That was my buffer. But I will tell my patients now, my job, I'm the visionary of your health. I'm going to tell you, this is where you need to go. The health coach will take you from kindergarten to PhD level. But this is where you need to go. That's my approach to that.
Altamash and I just talked about this literally in our last episodes. About meeting people's expectations and how they want to get coached. Yep.
Yeah.
Well, on one hand, we tell patients should be their own decision maker. And then the next time when you get, have you noticed, like you get a letter from Blue Cross Blue Shield saying, hey, your patient has not had a mammogram. What are you doing about it? I'm like, what am I supposed to do about it? I gave a script. I'm done. Like it's their free will to go do the mammogram or not, but you get dinged for it. Yeah. So on one hand, you don't want to be have a patriarchal system, but on the other hand, you want to give them the freedom. And then when they don't do the right things, you're held responsible. So there's a lot of confusion in medicine. That's all I can say.
Not being a primary care provider in the conventional system at this point, I will say, I think that might be that might be a regional thing as well. Like for instance, if you are in one of those large systems on the West Coast, Kaiser being the first one that comes to mind, I find those primary care doctors get dinged a lot more. I don't see that on the East Coast as much. And now I know I guess Michigan's secondly East Coast. Midwest. Okay, so good. So, so I wonder how much of, or maybe we're shying away from that. I mean, I don't know, do you have a pulse on that? Do you talk to your colleagues a lot who are not, or still in the conventional model? Are they still being dinged to that extent for that stuff?
Oh, yeah. Yeah, absolutely. A majority of the lawsuits, I used to sit on the insurance, the peer review, and many of them were, the patient was given a colonoscopy, they were bleeding, were given a colonoscopy referral, but nobody followed through. Like, who is supposed to follow through?
Right.
But we are supposed to. So we are supposed to make sure. So my patients, I used to have a texting line and my staff would text them every week. And one of my patients called and said, can you stop bugging me? I know what I have to do. So, but without doing that, and we document all of these things. So our time goes in documentation and covering our asses to not get sued.
Yeah.
But at the same time, we talk about, giving the patient the freedom to do whatever they want, which should include all of this too.
Sure.
In my opinion.
Yeah, I read, come to mind, I forget where I was listening to this, and this psychologist, or she's a professor, talking about how, responsibility and blame are different things. Like you might not necessarily be responsible of where you are in life in terms of your genetics and the circumstances that you had in life, that patient's story that you shared in terms of her adoptions. It sounds to me like perhaps she stayed in a relationship longer than she had to because she felt like she owed something to the mom, right? So I don't know if that was your assessment as well, but it is your responsibility to take care of where it is that you're going, right?
Yes.
So within that person's instance, cutting off the ties that she identified as toxic. I want to come back to your definition of functional medicine. And towards the end, I'm going to ask you to try to convince me to go down that road. And I'll tell you what my hesitancy with it is. But when you lay those 5 foundations out, to me, that sounds like lifestyle medicine. what we recognize as modern day American College of Lifestyle Medicine, where you can be board certified.
Yes.
So two thoughts that come to mind with that is like, one, does functional medicine need to be rebranded, right? And where more people will feel comfortable, such as myself, saying that's what they do. And two, I'm also curious now to really understand the why behind it. Truly went towards more protocol-based stuff and siloed, so to speak, whereas in you were the visionary and kind of actually, guiding the patient through that journey. Whereas now it was like, you're going to go see the nutritionist for that. You'll see the strength and conditioning coach for that. I will write the prescriptions because only I am legally able to do that. Because it almost makes me think that if there was a reason we could identify that, then we can prevent, American College of Lifestyle Medicine from doing amazing things right now to head down the same road, right? Repeat our mistakes. We're all prone to do that. Any thoughts on that?
Yeah, I can tell you. So I did ACLM too, and I didn't get board certified. I almost sat for the exam and then I decided I would not, because a lot of it was how to coach, how to make sure you convey these lifestyle changes to a patient. I will say this. Again, I can give you an example, a story where lifestyle medicine wouldn't have helped this patient. So this was a young lady. When I say young, she's in her 50s. She's been on 3 inhalers for her asthma for the last 5 years. She's been on 4 blood pressure medicines. She can't sleep at night. She has not slept in her bed for 8 years. And she says, I have a feeling it's because I was exposed to mold. And I said, how do you know? And she said, during COVID, we're working from home. I felt a little better. The minute I walked into my office, I had an asthma attack. And I know that there was a sewage pipe that broke and the carpet was cleaned out and changed. I know there's mold. And this was my first exposure. This was, I was somewhere halfway through the training and I just had started learning about mold-related illness. So I was 1 foot in conventional medicine, 1 foot in functional medicine. And the neurologist said there is no mold-related illness. So I remember learning about mold and I said, I don't know much about mold, but we'll work through this. I have people I can consult and I can help you through this. And I remember doing the specific lifestyle changes, made her change her diet. She was already very fit. She liked to exercise, but she couldn't sleep. And I started adding the mold binders and doing, first of all, we did the testing, saw what kind of mycotoxin, and then started doing the mold binders. I still remember we started the treatment in September. In December, around Christmas, she said, I just wanted to thank you. I haven't used my inhaler. By March, she said, my husband wants to thank you because I've gone back to bed and I'm sleeping in bed now. And I actually sleep at night. That will not happen if you do lifestyle medicine. So mold-related illness, Lyme disease, when it comes to even metabolic syndrome, the testing, what really attracted me to functional medicine is the depth of testing, the genetics SNPs, and connecting the blood work to the genes and then creating a lifestyle protocol that actually works for the patient. And it's very different. So in lifestyle medicine, a lot of it is plant-based, right? In here, most of our patients have been eating meat. They come from some farms. They've been drinking milk. You can switch them over. So you have to work with them in a different way. And I have to connect them to their blood work. Most of them do become plant-forward Mediterranean eventually. But there's no one protocol that fits everything. And to me, lifestyle medicine seemed like everybody needs to be on a plant-based diet, then everybody would be good. I think plant-based diet is great for cardiometabolic health, but the rest of it, there are a lot of nuances. And functional medicine really taught me how to deal with those complex conditions where these people have no other place to go. I mean, when you have mold and Lyme.
Yeah. I buy that. Earlier we were talking about the why behind the disease. So the buzz phrase is root cause. People will throw root cause around a lot, right?
Yes.
Always gives me a little bit of pause. And I'll tell you why. I do think that sometimes we do get obsessed in finding behind the why. And I find, and it might just be a bias with respect to the type of patients that I see, the type of problems that I see, but the question I ask my patients, I'll ask them, I was like, is it important to get better, or is it important to understand why you're experiencing what you're experiencing? It's a bit of a catch-22 question because they don't feel comfortable answering it either way, right? And so they'll look at me and say, both in a question format? And of course I want to do both, right? But the strategy might change in terms of what comes before the next, right? Are we going to go down this extensive, deep panel that you described first? And maybe that means advanced diagnostic imaging, MRIs, et cetera, and wait to see. And then there is a lag between when we get these results back. Again, this is using the conventional model, right? We might not have this conversation again 2 months from now. Or are we going to intervene now and either use medication, supplementation? And I also want to actually just highlight this because I think that those listening to this and whatever title this episode is going to have are going to have some type of confirmation bias for functional medicine, and it's the greatest drug in the world. I know you mentioned that in your earlier journey that you found out that medicine wasn't the solution. I think even most functional, and correct me if I'm wrong, it can be part of the solution, right? We're not completely saying the medicine is completely out and it's only supplementation. I think that's sometimes where people get tripped up. And that's a conversation that I have. Like, people will say, I will take 37 supplements for non-reputable companies, but I refuse to take Tylenol, right? Because it causes autism, or something crazy, right? Like even like a gram a day, something crazy because, well, no, that's going to affect my liver. But, these other supplementation with, non-FDA approved, non-CGMP, not NSF, nothing like that I'll pick up off of Amazon. So that cognitive dissonance is very interesting to me. But to come back to the original question, sometimes I feel like we perseverate over the why too much. I mean, the reality is the physiology is incredibly complex. We don't really have a lot of Dr. Houses walking around nowadays. We certainly don't. I know that my physical exam skills are shit compared to the docs 20 years from now doing musculoskeletal medicine in India that you're talking about, right? So, sometimes this is the best that we have. So, any thoughts on that?
Yeah, for sure. Do you know what I do? Almost literally, this is a prescription I give 3 or 4 times every day today. I know you guys can guess it.
Take a deep breath.
I was going to say breathing. That's funny.
No, GLP-1.
Oh, okay. Right.
Right?
Yeah.
So I'm a functional medical doctor, but honestly, my patients have tried just about everything to lose weight. And I give them a low dose GLP. They'll lose all that extra 20 pounds that they could not lose.
Right.
Because it literally shifted the food noise. Now, I will say this. Functional medicine is not like dissing conventional medicine. It is not at all. It is not, it's saying medicines are not your only option.
Right.
It is an option, but it's not your only option. A conventional medical doctor says this is your only option. I know I was trained to tell people to take metformin. If you don't take metformin, your kidneys are going to fail. You're going to be on dialysis. You're going to go blind and you will be amputating your toes. I've said this to my patients because that's what I was taught. Because we need to make them compliant. That is no way to practice medicine. This is like going to church and say, Jesus will take out your eyes if you sin. Who's going to go to church after that? So it's, nothing to, sorry, my husband's Catholic. I go to the temple. It's nothing against anything, but it's just, you need to have a conversation with the patient. The patient has to lead their health care. But they also need to know they have choices. They have options. I ask my patients several times. I'll say, I used to ask them, so how many vegetables? Oh, I eat a lot of vegetables. So now what do? I know that they're not eating vegetables because they're coming to me with constipation. I tell them, do you eat a pound of vegetables a day? And they're like, oh, a pound? No, I don't. Okay, I want you to eat a pound of vegetables a day.
That's
and here's the list I want. I know. It's not a lot. Actually, it's not a lot. Have you heard of a pound of cure? It's actually a bariatric surgeon who's written that book.
Oh, really?
Yeah, he gives only a pound of vegetables to his patients after bariatric surgery instead of asking them to drink a lot of protein, and they keep their weight off. So anyways, the thing is most patients don't realize their day-to-day habits are creating their health problems. They're not genetically wired. So I come from a family, all 9 of my aunts and uncles are diabetics. 5 of them are dead from complications of diabetes, gangrene and end-stage renal disease, stroke, and heart attack. My hemoglobin A1C was 6 when I started at the age of 42 when I started functional medicine. Now it's 5 and I have an insulin of 5 and I maintain it that way. What runs in my family are eating habits. I used to eat a rice 3 times a day, even when I moved to the United States, right? You have to shift certain things based on your environment. I'm sitting 8 hours a day seeing patients. What have I done to earn a bowl of rice? Nothing. So the conversation is very different. You have to really connect with the patient. You have to lay down the options for them. Now, if a patient comes to me with high blood pressure, I tell them, we'll get your blood pressure down naturally, but you're going to have to take a blood pressure medicine. Because there are certain conditions you don't play around with. You don't wait, like you said, 2 months. Let's go try this diet and I'll measure your blood pressure in 2 months. No, you do start medications. But at the same time, I'm also telling them to eat beets. I'm trying to add something that'll raise their nitric oxide, something that will, DASH diet or a Mediterranean diet. So everything is being done together. And then as they lose weight, as their blood pressure, what they monitor is coming down, then we start weaning off medication. I've done that too. So I think medicine is almost an art. There's a science to it, but it's an art. And every individual is an individual piece of art because they have brought in there's a reason why they are the way they are. And you have to address that.
Yeah.
There's a nice echo at the back.
Sorry, the cruise ships are going off. So,
oh, nice.
yeah. Oh, there you go again. So, I want to bring it back to the protocols and the supplementation that you're talking about. I mean, I think I understand that the history of functional medicine and where it started. I wouldn't say, root cause, I think, as Altamash said, is kind of, I think, where it kind of all started. And now we're seeing more of this supplementation, like you said. Altamash and I were Altamash sent me a link the other day about examine.com, and they have a pro version now where you can build out protocols through their, different supplements, and then you can give that to patients, right? So it seems like, and it's a well-trusted website that does their own research and everything. So definitely seems like we're headed down that way. At these conferences, who is setting these agendas for the protocols? Are they independent researchers? Are they companies? Are they just providers like us? Where's this coming from?
Yeah. So when you look at the talks, they actually do evidence-based medicine. They will say, hey, this is what has been studied, or this herb has been studied, or this supplement has been studied. It'll be a very small, it's less than 100. So it's not like a big study. It's not like 1,000 people took the supplement. And so a lot of it is evidence-based. And it is by people who have practiced this way for several years. It's more of anecdotal. And they do actually have a grading system where they have an ABC, where they'll say this is evidence-based, this is anecdotal. So you know what is anecdotal and what is evidence-based. They're very good about organizing it. But one of the things about what I've noticed is the wave of questions that come is always about the supplements. So this is us providers. Our minds are like that. This is not, so once you go to a conference and people are asking more, I want to know more about the treatment, that's what you're going to give. And so my posts are about because I see these patients, they come to me with this 25 pages of supplements. And I'm like, who put you on this? Oh, is this a problem, Darsh?
No, you're fine. I'm just thinking, I had a follow-up, but go ahead.
Yeah, okay. So that's what I find that they come in with these 25 pages of supplements and they'll tell me how they are taking it. Like this has to be taken with food. This has to be taken away from food. That has to be taken away from their thyroid. My mind just explodes when I listen to that. And I'm like, so what do you eat for breakfast? Oh, I grab a bagel on my way out. And I'm like, well, let's clean that up first before we go to these complex protocols. And I think that's where I'm coming from. Talk to the patient about what is the life that they live every day. Because if food is medicine and they're taking it 4 to 5 times a day, let's look at the quality of that first before we throw all these supplements.
I think just to kind of follow up, actually, first I wanted to know, have you directly asked that question of these clinicians, these providers? Why do they want to know about supplementation? Who's driving that curiosity that they have? Is it the patients and that's what they want to know?
100%. Right. It is the consumer. The consumer comes and says, I have adrenal fatigue. What should I be taking? Can I get my 4-point cortisol done? And I'm like, the 4-point cortisol, you drink a cup of coffee, it's going to go up.
Right.
You $2.99 for that. I can tell you what your cortisol is, right? So yeah, a lot of it is, let me put it this way. There's a lot of marketing in functional medicine. The labs are marketing their labs. The supplement companies are marketing their supplement. They have webinars. So patients they listen to what they feel resonates for them and say, oh my God, if I don't take the blood pressure medicine that is causing my diabetes right now, this supplement might actually be better. I have currently a patient who has hip pain. She's had this hip pain for like 6 months. And every time she says, oh, it's just intermittent, nothing. I said, I need you to get an MRI. You cannot walk around with a hip pain, go to physical therapy. And she doesn't want to do an MRI because of the radiation. She doesn't want to take any medication because of because it's a medicine. It took me so much time to convince her, like, we need to make sure nothing pathological is happening, and then we can work on the inflammation part. Yeah. So I think we as clinicians have to be very careful how we guide our patients. But when the patient comes and pressurizes you and says, I want a bunch of supplements, we seem to be succumbing to that and saying, okay, let me give a quick fix.
I love this thread that we're going down, Darsh. Sorry, I know you want to jump in here. I'm just kind of wondering, as you're talking about this, who's responsible for steering this conversation, right? Because having that everything bagel with cream cheese that I would love so much and taking some berberine to blunt my glucose response sounds a lot easier. And I know it's a lot easier than not having the bagel when I'm craving the bagel. And we're lazy and we want the easiest path between point A to point B, between my current journey and my weight loss journey. That's the path that seems easiest to me. So when I go as a consumer who is not necessarily knowledgeable about medicine and lifestyle and sustainable change, I propose the easiest path because I read it and somebody out there, like you said, is advocating for it on social media. It sounds to me like you're arguing that it is that provider, that practitioner's duty to help reframe that person's thinking. And so then the question becomes, and I don't remember exactly the post is, at that point, when that provider, rather than doing that, goes to the conferences and tries to give their consumer what they want, should it be the organization? Is it their duty at that point as, hey, we are kind of governing this functional medicine field and this is how we should be thinking about it? So, or is that not going to happen, right? As the saying goes, nobody's coming to save you, so you have to do it yourself.
Yes. The last few functional medical conferences that I did attend, I started bringing that up in the small focus groups that we were part of. It's like, we got to talk about the diet. And then when you talk about diet, everybody wants to go on a carnivore diet or a keto diet, which again blows my mind, right? And so there's a lot of this, what the consumer wants, what is a fad. And unfortunately, the organization is trying to get the evidence to support that particular fad. That's what I'm noticing. And it lost its charm for me. Let me put it that way. It really lost its charm for me where I didn't, even like when I go to I am part of the National Lipid Association because I'm very interested in cardiometabolic health. And when I go there, when I'm talking to them about, hey, did we talk about diet? And they also say that they went and saw the dietitian. And then they talk about all the different various cholesterol lowering medications that are in the market. We're all doing the same thing. That's the problem. We're just doing it differently. I feel on an individual level, the best bet for the patient is to find a clinician who will actually call them out on their bullshit. Like, yeah, you can't do all this and expect to be healthy. And I will say this, the company that I work for, I'm very blessed because patients seek us out and they're ready for change. Some of them will write, what she said was totally impractical for me. And I'm like, well, your leg pain is also impractical for you. Your back pain is impractical. Your headaches are impractical, right? And then I've seen the same patient actually evolve and tell me 6 months later, I don't know why I was kicking up such a fuss to do this right. So people do evolve, but you as the clinician, and I hate the word provider, I think we've all earned our name as physicians. And I will say, me as the physician, my job is to be patient and help the patient see that they have a huge responsibility in their health journey. And I tell them, it's your daily habits. Your body never creates disease. I've never known a body to just create a disease. It responds to a trigger that it receives. So if you're chronically stressed, you're putting in inflammatory food, you're not sleeping, you're scrolling at midnight, you have an interrupted sleep, you're eating sugary juice first thing in the morning, you're metabolically on fire. You're not going to feel well. So let's change that. Then a small dose of supplement, the smallest dose of medicine will actually work. So that's how my conversation goes with them.
You mentioned brainwashing, the conventional system. How much of it, I know consumers are an issue, right? When they come and they ask you for the supplementation, but how much is it the provider's quote unquote fault because they're brainwashed from a system and they jump into the functional medicine world?
I probably need to understand that question better. When you say
brainwashed in terms of thinking about treatment, thinking about protocol, and not getting so much into the coaching, right? I think the idea is you joined functional medicine, you want to practice this way of medicine because you were so brainwashed by conventional, you felt like you were doing the same thing over. But it seems like the normal trajectory of these fields, maybe it's functional medicine, maybe it's naturopathic, whatever it might be, is moving towards a standardization. So how much of that is, on the provider itself to say, to catch themselves and realize that they're taking their brainwashed ways and now putting it into what originally they did not want to do?
Yeah. I will say a lot of that's why it's an individualized medicine. It is really based on your clinician. If they are a part of a group, like if you see someone who's a line protocol, like there are some clinicians when I get transfer of patients, every patient of them has a Lyme test done, and every patient of them has had mycotoxins and had metals tested for. We're looking for zebras where we should be looking for horses, right? And so these patients are coming in saying, I have this MTHFR gene, so I don't methylate properly. And I'm like, I am not even sure that matters, honestly. But I don't say that loud, right? I mean, I used to say that loud before, but now I don't say that loud. And I'll explain to them, actually 70% of people have it and I have it too, but there's a way to bypass it. And these are the things you need to do. So I think, again, for me, I fell in love with functional medicine because it addressed the connection with the patient. It addressed the responsibility of the patient. Like, your health is your responsibility.
Yeah.
It is not my responsibility. My job is really to coach you back to the health that you can achieve for the decade of life you are in. I'm not trying to make you 20. If you're 30, I'm going to make you the best 30 you've ever been. That's all I can do. But it's not my job to, address every little problem that you have. I always ask my patients when they tell me, I've been having stomach issues, I'll say, why do you think you're having it? What changed? 100% they'll tell you what changed.
Yeah.
Before it was like, they just come and complain. When you say, what's your chief complaint? Today, I have diarrhea, I have constipation, or irritable bowel, here's your Bentyl. You're done. But if you ask them, why do you think it's happening? They'll tell you.
Yeah.
And after that, you could have that conversation. That's how that's why we take time with our patients. And I don't know if that's happening now. And I haven't gone to functional medical conferences in about 3 or 4 years now. Yeah, I probably need to go back to see if they've changed something. But so far, the feedback has been, it was fun to meet other people, but I've never heard much about the conference itself.
Yeah. That's unfortunate.
Yeah, I can see here the last hour, I get hints of how you practice, right? And the way you coach and the way you talk. When patients come with a mindset of they already knowing what type of protocol they need, right? They're using AI at this point to kind of figure it out.
I love that, yes.
How do you distinguish yourself as a functional medicine provider then? How do you keep getting clients? How do you stay in business when, you obviously are coaching in a different way?
Okay, I won't mention the lab, but there's a big direct-to-consumer lab for functional medicine. People go get their functional medical labs done. They get AI-read results. They panic and come to us. They'll say, I think I'm going to have a heart attack. My knee is positive. What do I do? Your is 1:20. You're not having any problems. Trust me, you're not dying of autoimmune. They need us. So we do. I will say I love my patients who, in fact, I worked with, I don't know if you know Neil Shah from Care. He's a startup. He's on LinkedIn. I worked with his team and we created an app called Evidentia, which is only for functional medicine, which give it to my patients. I tell them, if you want to run all of your supplements there, you can run it, because I want my patients to be well educated. When they come to me, I know I'm going to know better than AI. I know for a fact I'll know better than AI. That's number one. Number two, when they do, like I recently had a patient who had SIBO and she sent me a lot of PubMed articles. She wanted more supplements than what I had given her. I said, listen, I've practiced this for so many years. Yes, those studies exist, but all of my patients complain. But if you wish to try it, go ahead and try it. That's the thing about functional medicine. It's not like conventional medicine where you're dogmatic and you just tell them, okay, no, this is my protocol and you'll just follow it. I let my patients experiment and they'll come back and say, oh, no, that didn't work for me. And I'm like, I've done this before, so just take what I will tell. And I'd give them a timeline. I'll say in 2 weeks, if you're not better, we'll make an iteration to your plan. So this is not like a perfect science. It's really trying to get the patient to be better, but the patient has to do their job too. They have to shift how they sleep. What is their stress? What do they eat on a daily basis? If they're in a toxic job, how many times I've made patients quit their jobs? Because like you said, root cause. What is root cause? Root cause is your job. I can't tell you the number of people who quit their job. They stop drinking because they're not going out for the evenings gatherings with their team.
Happy hour, right?
Yeah, the happy hour. They have time to run. They have time to cook. They took a pay cut, went to a different job, and none of their symptoms exist. That is the root cause. Sometimes it's hiding in plain sight. But that's the conversation we need to have with our patients. Otherwise, they're clueless.
I love this. Go ahead, Darsh.
So yeah, quick question there. Quick follow-up. How do you convince people that their health is more important than their job or whatever it is at that point? Because I mean, we all hear it, right? Without your health, you don't have anything.
Yeah.
I think it all hits for maybe all 5 to 10 minutes, but then you get back to chasing the money and, having to impress your boss and going to that happy hour. So how do you convince people?
I ask them the question. I'll tell them, what do you think needs to change? And most people are so smart. We're not dummies. They'll tell me, I know I need to get a new job. So I said, till you get a new job, how can you change what you're experiencing? And we have to make our patients think. I don't know if you've experienced this. For me, in conventional medicine, I used to think there's no other way to practice medicine, right? Everybody needs to be on metformin and aspirin and a statin and all of that. I never asked the question why. They said, studies have shown. And I'm like, oh, studies have shown. I was just vomiting everything that I was told in conferences. That's what we did. But when someone opened my mind to functional medicine, asked the question why, and it's suddenly like a whole channel in my brain opened. And I realized why I hated medicine all this while, because I was not successful in making anybody better. Now I know I have to ask the right questions. Similarly with our patients, we need to learn to ask the right question. They've never thought about their job. They've always thought I'm stuck with this job. They don't realize that there's a toxicity to it, that their daily habits are driving this. And when you help them see that, they completely transform. But I will say this. First of all, when patients come to functional medicine, they know that they have to make some changes. If they're not ready to make some changes, they will not join. I've never seen anybody. I mean, if I have to convince someone they need to take care of their health, I don't think that's the right way to approach it. They know that their health is important. And number two, you shouldn't have to sell health to them. You have to, we always ask them, what's your goal? Why did you join functional medicine? Oh, I want to get to the root cause and I want a holistic approach. And I'll tell them, no, functional medicine is not holistic. I hope you know that. And everybody's shocked. It's like, what do you mean by it's not holistic? I said, it's just a different way of thinking. At the end of the year, my job is to make you your best doctor, because you're the only one who's with you. You know all the shenanigans you do. So you know how to catch yourself. My job is to help you understand what your body responds to. So I'm very clear about the role of the patient in their own health care. And I don't think we should ever miss that. At the same time, you cannot, like, you mentioned there, Will, where you cannot wait for 8 weeks. You're going to say, okay, go do these tests. We'll wait for these tests. I'll tell them, hey, listening to your story, these are the changes I would like you to work with your health coaches, but these are the things you can do on your own. Like if it might be sauna, I might tell them, can you go to a sauna, go for massage? So it gives them that time away from that stress, and also hire a babysitter for 4 hours on a Sunday and go out for a coffee or a walk. These are the simple stuff that I tell them to do, and they are able to hear their own voices and realize what they need to change. And sometimes it's just giving them the space and the permission to do that.
I love that. And I know we've touched on tests a little bit here and there, and that seems to be another big one, right? So you used a couple of really key words you talked about at conferences. They were saying that there is evidence and it's evidence-based medicine. That's a phrase. Anecdotal, we talked about that too. I think some of the people who are going to be opposing the functional medicine philosophy, I would argue, probably don't understand it super well.
That's correct.
At least not as eloquently as you've described it. But others will say, well, that extensive panel, that comprehensive panel that you highlighted, a little while back, there isn't enough data to support us getting that. Aside from these principles that we're talking about, I'm also very interested in cost-conscious medicine.
Mm-hmm.
Right? Again, you're an immigrant. I'm an immigrant. We, come from, at least I personally come from like probably lower middle class growing up. And so I'm very cost-conscious, and the patient population I have, they can't afford a lot of these additional testing and things that the company pays for, the insurance company doesn't pay for. So I guess, how do you reconcile those things, right? So I think of a famous physician, I think it's Dr. Spencer Nadolsky and his brother Carl Nadolsky. I'm a big fan of them. At some point, I didn't used to be, because they would say functional medicine docs are quacks. And that would really rub me the wrong way, that word. Because in my experience, I've had conversations with multiple docs on here, off here, and that word seems to very...
it's harsh.
It is harsh, right? Because it's an immediate way to discredit somebody. But I think part of the reason, when I look at it from their perspective, they're probably coming back is, they would say, oh, look, alternative medicine, Ayurvedic medicine, or integrative medicine, if this actually had evidence, it would just be medicine. And I put that in quotes because that's what they would say. And I can see what they're trying to say, because Darsh and I have talked about this. I don't know how I feel about functional medicine, acupuncture, this type of medicine. I just think that there's good medicine and there's bad medicine. What you described to me, your experience the first, 9 years or 8 years that you were practicing, what you had to do was a way of practice that didn't align with your values. And that was like, this is not good medicine, and I'm going to step outside. Is that fair to say?
Yeah, for sure. As far as the comprehensive panel that we do, I will say this. It's expensive when you go with insurance. If you pay cash, it's anywhere from $200 to $400, and we can, kind of customize it to meet the patient's need. How much your GLP-1 agonist costs today? None of the insurances cover it.
Right.
It's $375 to $500 a month. Does any doctor hesitate to write that prescription? Does any patient hesitate to pay for it? Why? Because there is value in it.
Yeah.
There's a lot of value for the patient in this comprehensive panel. Do you think that when I see a patient, I can find out that they have insulin resistance, they have skin tags, they have the darkening of their skin, they're morbidly obese? I know that they have insulin resistance, but when I show them their fasting insulin is 25, I've connected them with their own health. That is invaluable. When will we stop this dogmatic medicine where it says, okay, I'm only going to do the test that I think I need to know to make a diagnosis for you. I need you involved in your care. So if I can show you have insulin resistance, I can show you have Hashimoto's, and Hashimoto's is connected to your gut health. And therefore, we need to address your gut health, which means we need to address what you're eating. It's really explaining to the patient what that lab tests mean. A lot of times, what do doctors say? Your cholesterol is good. That's it. I'm talking to them about the LP little a. I'm talking to them about what the apolipoprotein B. It's the bus that carries all the cholesterol that's going to lay the plaques in your arteries. They have this visual, and they will, now my patients say, my ApoB went down even before they see me. They'll send me an email. I'm so glad my ApoB went down, because now I've connected them to their labs. So people who say that we're over testing do not know what they're talking about. I always tell, before you criticize me, walk with me, shadow me one day, and tell me what I'm doing is not real medicine.
I really like that. It's obviously different than conventional medicine, where we're taught don't order something unless it's going to change management.
Mm-hmm.
And I honestly you don't learn that in residency training, but now that I'm a year out as an attending, it's definitely ingrained in my head, right? Because you don't want to get caught in something, the legality, and then you own it. But I think there is nuance to it, right? Just like you said, if you need to show a lab value to change behavior, maybe it is worth it to get that test, even though it won't change anything, but change the perceptions of that patient. So I really do like that. Maybe a little bit of a hot topic to put you in the hot seat here. Aside from conventional medicine being very good at urgent and emergent life-threatening conditions and treating patients for that, is there anything that conventional medicine does better than functional medicine?
I will say, I'm really trying. I mean, so for instance, surgically, like, when you take away somebody's pain, that's amazing. When you take away cancer and stuff like that, I really think conventional medicine does a lot of things good, but does it do it better? I think it's very organized. So, in functional medicine, like I said, it's more artsy. Everybody is doing their own thing. And even in a group that I'm practicing, we all have our own favorite supplements we give our patients. And so I can see when my patient goes to see another doctor because I'm not available that particular day, they come back with a list of supplements. I'm like, oh, I don't want to use any of these, but I don't say anything.
Example there. Let me just jump in there. Not to throw anybody, our colleagues in the bus.
Yeah.
An example of for a specific indication, you might like something where somebody else doesn't.
Yeah. So for instance, for gut healing, there's herbs which have L-glutamine in them that actually heal the gut. And I like a specific brand because I like the herbs and the enzymes that are present in that. Depending on where you're in your functional medical training, I find that some folks will use different supplements which have the same L-glutamine but different kind of herbs in it. And I just find I've not had success with it in the past. So now at the same time, I don't want to tell the patient, no, I don't like to, I just ask them, do you feel like it's working for you? They say, I really don't know if it's made a difference. So I'll say, once you're done with that, I'm going to give you something different. Let's see if that makes a difference for you. So I actually switch it over. So I will say it's not very organized. Functional medicine is not organized, but then again, you don't want it organized, right? You don't want it to be that protocol-based structure, like everybody comes, hey, this is the box we're all going to fit you in. That's why I like functional medicine. You could do whatever you want, but the ultimate goal is to get the patient better. You have to, as far as possible, resolve the problem they came to you with.
Nisha, you know what protocols are really good for is to eliminate deep level thinking that you're describing. So, we've been talking for a little over an hour at this point, and what I think probably the listener can gather is your approach is, comprehensive would be one word, deep reasoning, if I can describe you. You're like an 03 from ChatGPT, right? 03 Pro at this point, right? I mean that as a compliment. If I'm not pursuing medical training and I'm not pursuing extensive residency training and I'm getting a 2 years master's or whatever level training is in other professions, some of the allied professions, and I still want to practice functional medicine because that's you highlighted. Yes. Anybody can get it and get a certificate. I will not have the wisdom, I'll use that word, to be able to tease that out like you described. And therefore, a protocol is really good because, so when I look at, is it the AFM?
AFMC.
Yeah. Mm-hmm. So if I look at AFMC, I'm like, okay, well, we have a lot of non-physician practitioners who need these cheat sheets, so to speak, for protocols. So I don't know if this is, exempting them in any regard, but that just clicked for me. And I'm wondering how much that has to do with it.
Yeah, I think you should have a framework like, how you would approach. If you have somebody with Hashimoto's, how do you approach it? And there is a framework. But how I'm going to be using the supplements in that framework is going to be dependent on the patient's history, the patient's blood test. So I change a lot of those things and the patient's willingness to take supplements. I have some patients who will come and say, I don't want any supplements. I will not take any supplements. They will be on Adderall, they'll be on Xanax, they'll be on Ativan, they'll be on Vyvanse, but they will not take a supplement, right? You get those kind of patients too. So I'm just letting you know you have both ways. So for me, I feel like my experience, knowing the patient, where they're coming from, helps me choose the right kind of supplements. And then there are other patients who'll come to me and it's like, give me as many supplements as possible because I really want to feel good. And they take their own longevity supplements. They go to these longevity talks. Everybody feels like they know what they should do for their health. The blood test is the only one that sets apart how we approach it. Like when they come in, they said, I went to this conference and I got these 10 supplements. And when I'm doing their blood work and I'm telling them, you know what, your vitamin B12 is 2,500. I don't think you need to be taking homocysteine, cyprine, B complex, and SAMI. We're going to cut these things down. This is where I come in. And so in many ways, yeah, I agree with you. Maybe the framework is there, but I don't think we should be practicing protocol-based medicine at all when it comes to an individualized approach.
Is it possible to extract these principles from functional medicine and practice them in the conventional model with taking insurance, taking pairs? If so, how would you guide your younger self or a doctor to do that?
Parsley does that right now. So I work for Parsley Health. In New York and in California, we take Blue Cross Blue Shield, Aetna, and United Health. We pre-negotiated with the insurance. So Robin, who is the CEO, did a very smart thing. She created what is called the medical symptom questionnaire, or we call it the Parsley Symptom Index. And I think it's available for people to buy it. They can actually use it in their clinic. But patients fill these forms. They give us their symptoms. About 85% of our patients, when they come with an MSQ of, say, out of 200, they come at 189. By the time it's the 9th month with us, they are at 20. Most of their issues have resolved. She took that data, negotiated with the insurance, and created like a reimbursement for 1 hour of new visit. So we actually see our patients for an hour. We see them in the second visit also for an hour. And the remaining visits are 30 minutes. And we get reimbursed for that. Because you have to show value added, because most of our patients seem to be subjective data definitely improves. Objective findings also improve. A lot of people, their A1C reverses, their insulin is back to normal. Their inflammation markers are gone. They're getting off of the immunomodulators, getting down on their blood pressure medicine. Like I said, this one patient I treated for a mold, she was on one blood pressure medicine by the time she left we finished her mold treatment. So you have to show the data. So I think what I wish I had done that at that time, Blue Cross Blue Shield had what is called patient-centered medical home. They would give you more reimbursement if you made sure your patient was referred and you got the referral and all of this communication. But actually, we showed results. Like our patients actually lost weight. Our patients' blood pressure got under control with less medications. I think you can get reimbursed. You just have to collect that data.
Awesome. Where does functional medicine go from here? How does it expand? And I guess I'll preemptively ask you too, when it comes to trainees, and again, a lot of trainees are interested in this holistic, again, if like functional medicine is not holistic, but just to kind of branch it in there, Sherlock Holmes type medicine.
Yeah.
Where does functional medicine go from here? How does it continue to market, brand itself, maybe up-brand, rebrand? How does it get more noticed?
I think people are trying different things. I will say Dr. Andrew Weil with his integrative medicine. I think there are about 25 medical schools across the country who have an integrative medical track, and there's some places that have functional medical track. I will say that we need to bring it into our residencies. I think medical students should have that option. If I want to do a primary care, can I go into, there's something called preventive medicine. Can I go into functional medicine? And if so, how do we get a rotation or maybe a 6-month rotation in functional medicine? And then you continue to learn. I mean, none of us stop learning after medical school. In fact, I think what I learned in medical school is kindergarten version of medicine that I practice now, right? We continue to evolve. We learn with every year. I mean, the number of articles and studies that are coming out, I can't even keep up. So I think it should start in medical school. Once you start practicing, I think, to me, Parsley has done a fantastic job of branding. And we don't do many of these, cheesy marketing, like what your doctor has not told you. And the pharmaceuticals are out to get your thyroid. And, you're going to be dying when you take these medicines. So like your teeth are going to rot because you're on GLP-1 agonist. We don't do any of that. We follow whatever is evidence-based. And it's just initially built word of mouth. And now there has to be a little marketing. We all have to do a little marketing. I can't imagine medicine going forward. I think the number of medical systems that are closing down because they don't have enough patients is ridiculous, right? With Medicaid and with Medicare, probably because they're not getting reimbursed. But in general, we shouldn't have to, you cannot just sit there, open your shop and say, I'm going to get patients. And if that's going to happen, it's going to take you 5 years to build the practice. I've done my own private practice. And I will say, if I couldn't afford myself, that's how much I was charging. Functional medicine should not be a luxury. It should be the way medicine is practiced. But functional medicine should be something that the patient has a choice. You don't push them into functional medicine. You don't tell them, like, at the VA, I remember I used to tell my patients when I first learned about lifestyle medicine, I tell them, I can give you the diet or I can give you the statin, 4 months of diet, and then we can try the statin. They'll tell me, doc, just give me the statin. I'm not changing my diet. So not everybody, functional medicine is not for everyone, but patients need to have a choice. And I think insurances should cover, but the funny part about insurance is, they'll cover it in New York and California, but every state you have to go and sit with the board, the insurance to be covered in each state. We're in 50 states, but we're not covered everywhere, right?
Nisha, I have a question for you. Do you think that if you were first introduced to the concept of functional medicine through your medical training and even earlier in your career, and then fell into the quote unquote conventional model, and I know we're kind of putting them as these diametrically opposed things. And I don't think they are. I don't think any of us are saying that they are. But again, just to make it clear for the listener. But do you think if you had your origins were there today, you wouldn't necessarily be calling it two separate things? I'm concerned that this polarizing nature, these conversations that people continue having, which type of medicine is better, like you highlighted earlier, with the Lipid Association, those folks there, like in every silo, people are doing the same exact thing. And in the end, the only person who suffers really, or suffers the greatest, is the patient.
Yes.
Right? We're all having these debates, so to speak. So I'm just wondering if it's helpful or not to actually even just talk about them as they're completely separate things.
I've thought about this a lot. And when medical students used to ask me, I want to do just functional medicine, I always tell them, know the beast before you go into functional medicine. So I liked the way I learned it. I really love the fact that I spent so much time learning about the disease. And then when I learned functional medicine, it just clicked. It was like a puzzle piece that I couldn't put together. I didn't know what was missing, but it clicked. If I learned only functional medicine and never did the hardcore internal medicine, the ICU rotations, the ER rotations, I don't think I would have so much of, appreciation for both conventional, because I respect conventional medicine. I'm not one of those doctors who says, don't listen to it. Like people come and say, my cardiologist said, I don't need a statin. I'm the one who will pick up the phone and tell the cardiologist, I think she needs a statin. Why did you say she doesn't need a statin? That's where I am. But I do love conventional medicine because I think I love the studies, though it's very, the evidence base is one drug and, it has its own problems. But then doing functional medicine, I feel I was able to understand the journey to wellness, because it's almost like knowing the signs of illness and then understanding the art of healing. I think that's how you should do it. If you learn just the art of healing, I don't know if my mind would have been open to disease, because disease is a delusion. Truly, it's a delusion, right? Disease is what we develop because of our day-to-day habits. Literally. Show me one disease, chronic disease, that happened because it was just genetic. I don't know. Maybe sickle cell disease, but that's again, we see it very early. But diabetes or high blood pressure, these are all things that evolve over the decades. You develop these diseases. You don't get them. You get a pneumonia, you get a urinary tract infection. So one drug will cure that. But the rest of the diseases are diseases you evolve because you've done 10 or 15 things wrong on a consistent basis for 10 years. One donut is not going to kill you, but a donut every day for 35 years will. And I think that's where I see it.
I want to quickly jump in there because I understand this is not what you're saying, but just for the layperson, I like the distinction you made between developing and getting, and it does take time. That being said, though, I think certainly there are people who are more predisposed to certain things. And as the saying goes, right, the genetics load the gun, but, however it goes, and epigenetics, we understand. So I just want to, so people aren't like, oh my God, this is all my fault. And, look, if both of your parents have heart attacks at 45, like you might, or if you're LP at little age,
you're at a much higher risk.
Right.
No, for sure. But then if at 20 you said, hey, my dad had a heart attack at 40.
Sure.
At 20, you started getting evaluated and started making the changes.
Yep.
You can make the change is what I'm trying to say.
Yeah.
So have a space for health as you do for wealth. Unfortunately, health and wealth builds up at the same time, right? In your 20s and 30s. And even in the 40s and 50s, you can still build your health. That's what I tell my patients. I tell them, all I need is the desire to get healthy, and you will be able to. I have my oldest patient now, 70, and the first thing she asked me, she told me, do you think it's too late for me? And I said, what? If it's not too late, if you don't think it's too late. And within about 3 months, she brought down her A1C by 2 points. She just didn't know how to do it. So I think at no time is it wrong. And again, the development happens without our knowledge. I was a pre-diabetic when I started this journey. Not that, I wasn't doing anything. I was eating salads. I was exercising, but I wasn't doing a lot of things right. So I think it's really understanding that most chronic diseases, there are a lot of triggers and mediators. We are feeding the evolution of the disease without our knowledge. And what functional medicine does is educates you on how you can change your epigenetics.
I love it. Nisha, I'm so excited to share this with people, but I do want to give them something actionable to take away. So
yes,
as you've highlighted, not all functional medicine is created equal. Not all clinicians, physicians are created equal who are practicing any type of medicine for that matter.
That's correct.
So what are some ways that the consumer, to use that word again, can tease out who is going to be a good functional medicine clinician versus somebody who is just going to follow the cookie cutter protocol, push supplements, kind of things that we're not all fans of?
Yeah. So I think it depends on your goal, right? If you, maybe I'm biased because I'm a physician, I think you start with someone who's trained in a physician who's trained in functional medicine, and let them tell you, okay, listen, I do need you to see the pharmacist because you're on bunch of who's also trained in functional medicine, so they can teach out your medicines. But I think you need the first thing is the encounter. See, number one, have they read your history? Are they asking you questions about your lifestyle before they push supplements? And are they explaining their thought process? I have never ordered a test with my patient without telling them. I don't say I'm going to order a blood test. I'm going to tell them what blood test I'm ordering and why I'm ordering, what my thought process is. And I ask them to repeat, do you understand where we're going with this? And they will actually tell me that. So it should be almost like a conversation, because this is it's almost like, when you buy a house or you're building a house, do you tell the builder, do whatever you want? No, you're going to give them what you want. So I think it should be that kind of a conversation. You're building your health. You need to tell me what is practical for you. And I'm going to tell you what my thought process is from what you've told me, where I think I should, which rabbit hole do I need to go? And I usually tell them, I'll go down this rabbit hole. We'll fix this, but we may need to address these other things also that are hanging, or they may get better as we work on this. So that's why we need that 1 hour. So the conversation is such that the patient walks away with clarity about what's going on with them and what the next steps are. But if they're walking away with, or they order some blood tests and she gave me some supplements because she thinks it's irritable bowel, you've already lost it there.
I love that. It puts the power in the hands of the patient, provider, and the system as a whole. So, all three kind of connect there. So that's good. So Nisha, you work at Parsley Health, the household name. I've been following you guys for a long time. I love the educational content. Where can our listeners go to follow you specifically?
It'll be only on LinkedIn right now. I'm not on any of the other social media platforms. I'm there, but I'm not active. And so follow my posts. Please like my posts on LinkedIn, share them. It's always about functional medicine. And of course, at Parsley Health too.
Awesome. We'll love it because that's where we found you and your awesome posts. So we can double down on that. And we'll be sharing clips and things like that to promote you as well. So if anyone wants to check out some snippets from this episode, we'll post on LinkedIn and tag you. So it'll be easy to find.
Yeah, thank you.
Before we ask the last question, Nisha, we just want to thank you. I mean, you've really brought a lot of nuance, a lot of reality to this conversation. And I think that's something that is much needed in this space, especially with so much of the noise that's going on in social media. So I'm really excited, not only for our listeners, but also other providers. I can't wait to share this with them because I think everything you said, honestly, it was just enlightening. And it's good to hear that there are people out there that are sending this message. So I just want to thank you again for that.
Yeah.
Our final question is, how do we put the health back into healthcare?
I think it really comes down to, first of all, functional medicine should become mainstream. I don't know how we're going to make it, but we're going to try. We're going to keep trying. At least Parsley Health will. The only way to put health into healthcare is to have an awareness that you can actually be healthy. We're a community that will wear ribbons, go marching for breast cancer and cervical cancer and prostate cancer. But when somebody says, I'm going to exercise and I'm going to go for a triathlon, I'm not eating gluten, or I don't want to drink alcohol, we make fun of them. We really need to celebrate health and not disease. So the only way to get health into healthcare is to actually respect health when you have it, not after you lose it.
I love the no bullshit approach. I'm a fan. Thanks, Dr. Nisha.
Thank you. Thank you guys for this opportunity.